Hi, this is Dr.Srimannarayana, surgical gastroenterologist and laparoscopic surgeon, Renova Hospital, Sanat Nagar. Coming to the more common symptoms of chronic pancreatitis, before going to chronic pancreatitis, I just briefly on the acute pancreatitis. Acute means sudden attack, chronic means long-term attack. This is just a brief explanation. In acute pancreatitis, there is the history of, may not be there, may be there, history of recent alcoholic intake, but more commonly bing intake, that means like a party intakes more, and presented with and patient will come to the casualty with the epigastric. Epigastric means upper abdominal pain, which is the stabbing type, and that means someone is pressing type of pain, and that pain will radiates to back. The same pain will present on the spine. Okay, and second thing is the patient will vomitings will be there, and third one is that pain will more on the, if the patient is sleeping position, the pain will be more, and that pain will be less when you are in the sitting position. This is the more common in the acute pancreatitis. Coming to the chronic pancreatitis, this type of attacks will be presenting almost at least 2-3 years, associated with recent history of weight loss. Patient doesn't want to go for weight loss program, but he has the weight loss. Why the weight loss in the pancreatitis? If you take in a pancreatic patient attacks, if you take the food, the pain will be more. So patient will fear of intake. That's why weight loss. And second thing is, for all digestive purpose, the pancreatic juice will be needed. In chronic pancreatitis patient, the production of juice will be less. So that's why there is no digestion, there is the weight loss. So second more common is the weight loss. And third one is the pancreas will surrounded by our stomach. So any pancreatic attacks, there is associated with the repeated vomitings will be there. And fourth one is in our diabetes, our sugar control is under the control of the pancreas. Suppose if any pancreatic attack is there, without any family history, the patient will observe the recent history of diabetes also. And diabetes, patient family history will not be there, but suddenly patient notice he has developed the diabetes at the age of less than 40 years. That may be the cause of pancreatitis. And fourth one is the motion issues. The patient will notice lot of motion with the greasy stools, foamy stools, frothy stools, and the smell also, the oily type of the smell will come, because our fat will be digested by the pancreatic juices. Suppose in pancreatic attack, the juice production will be less, the patient developed the motion abnormalities also. So if coming to the brief, the common symptoms of chronic pancreatitis will be the repeated attacks of pain in the abdomen, that is above your navel, which is radiating to back, one thing. Second thing is the repeated vomitings. Third one is the unanticipated, unwanted weight loss. In this patient's appetite will be okay, but the problem is patient is not able to eat because of fear. If a patient eats the food, he will get the pain. That's why he doesn't want to go for eating. And fourth one is the motion abnormality, what we call it as the steatorrhea. That is the fat in the stools, which is the greasy stools, frothy stools, more smell. You are unable to flush the toilet. And fifth one is without any family history, recent history of diabetes. These are the more common symptoms of chronic pancreatitis. Thank you.